Do you have any pain, aches, or any neurological condition? And you're wondering, like, can you do anything or exercise at home to help you with the recovery? Yes, you can. My name is Johnson, a registered physiotherapist, and my model is Aldina. We will show you a series of exercises that you can perform at home on your own or by the help of a caregiver. Aldina, let's go! In this video, I want to show you management of spinal injury at the comfort of your home. Spinal cord injury is an injury that occurs basically at the spinal cord. The spinal cord is a tube-like structure that links the head with the lower back. There are two types of spinal injury. There is complete and incomplete spinal cord injury. They both lead to loss in sensation. See? But in complete spinal cord injury, there is minimum sensation. In incomplete, you might have a lot of function still. So the determinant on how paralyzed you'll be when you get a spinal injury is the level of injury. When you get injury at the cervical level, which is the neck, you are most likely to suffer from quadriplegia, which is weakness on all limbs. When it's the thoracic, you might just struggle with the legs and the breathing system. And when it's the lumbar, which is the lower back, you are most likely going to suffer from weakness on the lower limbs. I want to show some exercises that we can do to restore function and to help patients get back to activities of daily living. First, we'll go to passive movements because they don't have function. So we'll try to do passive movements to help prevent bedsore and stiffness and contractures. Contractures are basically stiffening of muscles, tendons, and ligaments. So we start with passive stretching. Just hold the patient's leg, lift, because when there's complete spinal cord injury, it's highly likely they won't have a lot of sensation because both the sensory and the motor function is affected. So you push the leg and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you try and straighten the leg and move it on the side. 1. Are you comfortable? And when you're doing exercises, you have to look at the patient's face so that you can see if they're getting any discomfort. And another important point is that when you are stretching and doing exercise for a patient with complete spinal cord injury, some of them do not have sensation. They can't control urine. So you have to be careful because you might injure them because they don't have the feeling. They don't know. They can't tell you how much is enough. Good. Okay. Stretch. Good. Try and lift your hand. Good. Up. Down. But if they have power, you can just tell them to lock both hands. Then you try and bring it up and down. 1, 2, only 5, 3, 4, 5. Good work. The next thing you can do is the bridge. You support both legs. If the legs are weak, then you try and lift your hips as high as you can. 1. Good. 2. Good. 3, like 10. For those who can't do it, you assist them. Just try and up, like as high as you can. 4. Good. 5. 6. Good. 7. 8. 9, 10. Good work. Then you stretch. Then we're gonna do some assisted sit-ups where you just try and come up like 10. 1, then down, then 2. Good. Count 3. Good. 4 and 5. Good. 6, 7, 8, 9, 10. Good work. The next thing you do are deep breathing exercises. Okay, you breathe in through your nose and out through your mouth. Okay, let's go. 1, 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. Next exercise we're gonna do, if let me say it's the lumbar that has a problem, the hands will be active. Okay, so we help them sit, then just try and sit. Push yourself up. Good. Nice. Good. Then 1, 2, 3, 4, up to 10. 5, 6, 7, 8, 9, 10. Then you change. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. The next thing you're going to do, I'll help you lie on your tummy, then you do partial planks. Partial plank is like you do a plank, but there'll be half plank. Just your knees there, then your hands are spread, okay? There, then you lie on your tummy. Good. Then you try and bring your, it's like you're doing a half plank, okay? Yes, like that. Then you hold. Count for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. 30 seconds rest. Then we do another 10, okay? Good. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. So the reason why we do plank is like if there's a weakness on the legs, they can use their upper body just to wheel themselves, try and get some bit of independence. So the next one, we're going to do bed to wheelchair transfer, which is requires a lot of caution, especially if the patient does not have power on the lower legs. No, you'll have to have the right technique. You have to lock their legs before turning them to prevent a fall. Come down. Yeah. Sit there. So you place the wheelchair as close as possible. Okay. Then you hold me. Good. Then you lock their legs like this, the knees, so that they don't fall. Then you move them to the seat. Okay. So another important thing is like if the legs are very weak and the hands are moving, you can use your hands to move, to roll the wheelchair. Okay, so that you can move to the living room, because improved independence is good for even mental health. Okay, the last thing we're going to do is balance, which you're going to use this Swiss ball so that you work on your core muscles. So you just sit on it. I'm going to support you there and you try and balance. Okay, once you get the balance, you try and move it forward and backwards. Okay, but we'll start by just sitting, getting your balance. Okay, and you have to be very close to them when you're doing this. Okay, yes. So the balance, good. So your legs have to, the legs have to be there. Then often you'll support the leg there. If the hands are strong, they can support themselves here. Okay. Then once you get they are stable, you try and just play with it. Move forward and back. Yes, that way. 10 times. 1, 2, good. 3, 4, 5, 6, 7, 8, 9, 10. Then now side by side. 1, 2, 3, 4, 5, good. 6, 7, 8, 9, 10. The next one, you can just place your hands straight, yeah. Then 1, 2, no, just relax. 3, 4, 5, 6, 7, 8, 9, 10. Good work. Let's say wheelchair up, try and back step. The wheelchair, from the wheelchair to the bed. So those are some of the exercises that can improve the quality of life for your loved ones and make them better. And always, even in complete spinal cord injuries, you can always get back to your best or get good improvement. So there is always hope with discipline. Thank you very much.